This is Dr. Michael Tapper, and we're reporting to you today from the Microbe 2016 meeting, which is taking place in Boston, Massachusetts. And I'm joined by Dr. Hannah Imlay from the University of Michigan, who has presented a very interesting poster at this meeting about Clostridium difficile disease in the setting of pre-existing HIV disease. And I wonder if you could describe briefly for us some of the results and the data that you found about this interesting set of problems matched together.
Sure. So I looked at an HIV-infected cohort and wanted to look in this cohort mainly because the HIV population is increasing in age and increases the risk of C. difficile infection. There has been previously shown to be an increased risk of C. difficile acquisition in this group of patients, and so I was looking at some novel risk factors within HIV. Our study redemonstrated the risk of antibiotics exposure, increasing the risk of C. difficile as well as hospital exposure, and then also showed an interaction between PPI use and CD4 counts less than 200.
Proton pump inhibitors.
Correct, yeah.
Right.
As a risk factor.
Right. And these have all been reported previously as in the general medical population,
right,
although not specifically as in your poster in the HIV population.
Actually, many of them have.
Yeah.
So there's another cohort study that was done out of Johns Hopkins, I think between 2002 and 2010, which also identified some of the same ones, redemonstrated antibiotics and hospital exposure, as many studies do, and then did show an increased risk with CD4 counts less than 50.
Right.
And I believe they also had acid suppression as one of their risk factors.
Right. Well, I meant to say that these factors were very well established in everybody's mind as risk factors in the general medical population, right, not as well commented upon in the HIV population, right, even though the HIV population joins this population, the bigger population in terms of having some of the same risk factors, right, for C. difficile disease. Were there any takeaways? I didn't see specific data regarding treatment. I mean, obviously the treatment of C. difficile disease has become increasingly complicated. Mm-hmm. There are more drugs. At this meeting, there have been a number of presentations about novel approaches mm-hmm. To the prevention as well as to the management of C. difficile disease in terms of sequencing of antimicrobials, elimination of toxin, obviously ongoing interesting work about vaccines. Did you find any specific takeaways about challenges in treatment in the HIV population? We
didn't look necessarily specifically at treatment. We did initially set out to look at severity of disease as well as recurrence of C. difficile in the HIV population, but I had 46 cases identified, and within only 46 cases of about 1,400 HIV patients, there were just simply not enough to be able to present that data because there were only 3 or 4 recurrent cases. Right. And then in an ideal world, it would be nice to look at the treatments and responses to treatment, but again, too few to actually delineate those.
Find any kind of really statistical significance.
Right.
But it's an important association. I mean, there's a whole group of enteric pathogens that years ago used to be referred to as gay bowel syndrome and well associated with advanced HIV disease. Presumably most of these patients were on antiretroviral therapy or hopefully taking their antiretroviral therapy with some consistency. But I think it's important that all of us remember the importance of looking for C. difficile in the same population, particularly when they've been in healthcare facilities. But we also have to remember that there's a lot of C. difficile in the community now too. Mm-hmm. You don't have to be in a hospital or even an outpatient clinic to have C. difficile right. disease. We certainly have seen more than our share of C. difficile disease occurring in people who have no obvious source in terms of where they might have been to get it, but have certainly had the exposure with antimicrobials. Mm-hmm. So I assume you've seen some of the same thing.
Mm-hmm. I think there was a couple posters down from right. mine also that commented on increasing right. community isolates of C. difficile.
Again, important for us to remember, but not so important that at least with an important HIV disease, we forget about the value of some of the prophylactic antimicrobials also. And you did not really address that issue per se, but I think, the value of things like prophylactic trimethoprim sulfa and the value of things like prophylactic macrolides in terms of advanced HIV disease, I think go unchallenged mm-hmm. By your own data. Mm-hmm. That's still important that we prevent
right.
If we can't get people to take antiretrovirals and can't get their CD4 counts high enough that they get out of the risk area for some of the older opportunistic infections. Mm-hmm. Great. Well, thank you very much for joining us today.
Thanks.
Congratulations on your work. Good luck on your forthcoming fellowship.
Thank you.